Hello everyone, this is Eric with the Get Me Out of Here vlog. Before I get into the subject matter, I just wanted to say that I'm thinking of everyone out there going through this pandemic, this coronavirus pandemic, something that none of us have ever seen in our lives. And I wanted to say thank you to all the hardworking nurses and doctors out there on the front lines, treating patients, helping save lives, seeing the best and worst of humanity being there. I can't even imagine the things that you see every day, every night, 24 hours a day, the patients you are dealing with to help. And just wanted to say thank you from the bottom of my heart for doing what you do and stay positive. Keep working hard. We're going to get through this. We're going to see better days. America has been through pandemics before. We're going to get through this one as well. Everybody in isolation, you know, what the doctors say, keep washing your hands. If you have to run to Walmart, the grocery store, Godspeed. Make sure you are wiping down the carts and keeping your 6-foot social distance away from everyone else. I hate that phrase, but that's kind of the key phrase everybody is using today is social distancing. But anyway, wanted to say that we're in this together. So for everybody out there, stay positive. We will get through this together. And thank you again to all of the medical personnel working their asses off day by day to get through this thing. So thank you. Now to the subject matter. What I wanted to talk about was my recovery. Today, it's been 2 weeks exactly from the day I had shoulder surgery, specifically for distal clavicle osteolysis. And what that is, again, is an overworking injury. Basically, years of weightlifting in my younger years, in my 20s, caused the edge of my collarbone to disintegrate, and the bone did not repair itself. It stayed rotted and disintegrated where the collarbone meets the AC joint in the shoulder. So the surgery, the doctors took 8 millimeters out of my collarbone and they smoothed out the rough barbs in the side of that, smoothed out the edge of the bone, and they also repaired a little bit of my ligament as well. There was a slight ligament tear in my bicep or my arm there. So that was basically the summary of my surgery. It's been 14 days now in the recovery process, and I can say that I am making a lot of progress. I feel great. I still have a lot of soreness in my shoulder, which requires me to take some ibuprofen at least once or twice a day, usually first thing in the morning when I wake up, and again right before I go to bed. But that's really all I'm taking right now as far as painkillers go. There's still a lot of stiffness in my shoulder as well, but I've been doing physical therapy sessions twice a week at the clinic, which has been a great help. So any of you guys going through similar things, if you've seen a doctor and you also have distal clavicle osteolysis or other shoulder injuries, I cannot express enough how helpful physical therapy has been. Just going out, twice a week, maybe even three times a week in some cases, just doing some exercises, stretching out your joint and some of the muscles in your shoulder has made such a big difference for me. I feel so good each and every day after going through that. So thanks again for all the doctors and specialists out there doing that work. It's awesome. That's something that I'm really, really happy I signed up to do. They've also given me some home exercises that I can do. So let's go through some of these. I'll show you. All right, here's one exercise that I do at least 2 to 3 times a day and also at my physical therapy sessions. This one I love because it really just loosens up the shoulder. It's a good one to start out warming up with, but I do exercises like this where you lean against a hard surface. No, the stove is not on, it's off. It's a good thing. But anyway, you can do a table. I like doing the kitchen because it's just, it's convenient for me. So anyway, you just go like this. You just kind of swing your arm back and forth. You can kind of wind up almost like you're doing, like you're playing bags. Think you're playing like a bags game. You just kind of sit back and you go, just like that. If I had bags, this would be the perfect social distancing warm-up kind of exercise for me right now. So it's almost like you're playing a bags game. Just swing the shoulder. You can also spiral it around, do some circles. Oh, that feels great. I can really feel there's still a lot of soreness there at the top, but it really helps loosen it up. So let me rephrase. Physical therapy I did not start until after my post-operative doctor's appointment. So 1 week exactly after my surgery, I was given the green light to start physical therapy sessions. And the first day I was doing this, I could barely get past this angle. So basically it was just swinging it up to there. That's how stiff my arm was for being in that sling for a week. But now I'm able to almost go all the way laterally. So it feels great. It's a good warm up to do. All right, I'll show you some more. All right, this is another exercise you can do. You want to take a towel and grip it like this and go up to a wall and place your hands on the wall like so, and you just want to stretch it up as high as you can and then bring it back down. And you do this for about a minute each session, and it feels really good to just stretch out the shoulder. And I've been making progress on how high I get each time. So that's another really good workout that you can do at home. Here's some more. All right, so this exercise, I use a roll of paper towels. You could probably use a towel, or if you have some kind of exercise roller at home, that will work too. But this one, basically, you put your forearms on this, or your hands, and you just roll out like that to stretch your arms and shoulders, and then you bring it back. And you roll it back out, and then you slide back. And this feels really good. This is actually one of my favorite exercises to do. It's a little hard in my apartment to do this. I'm using an ironing board right now, which isn't the sturdiest thing to use. I just don't have like a high tabletop that I can use to really meet my height requirements. But this one I like to do in the physical therapy sessions. It just feels really good. I would have used toilet paper, but I didn't want to show off my stash here. That's top secret. I take that back. I guess I could use my dining room table to do this. It actually works pretty well. But this is a great exercise to do, to just stretch out your arms, your back, and your shoulder. It's one of my favorites. I love it. All right, this last exercise I'm going to show you, again, you take like a towel and I roll it up and just stick it, under my arm here. And what I do is put your palms up and just go like this. And do that. Hold it for a couple seconds. Give you a side view here. And that's another one that feels really, really good, especially since I've been in this sling like this, for a week and on and off since then. This one, since my arm has been in this inner position, it feels good to bring it out and work those outer muscles. So just doing that. All right. So hopefully that gives you a good idea of some of the home exercises that you can do to help loosen up your shoulder and break some of that tension and stiffness that's been in there since the surgery. All right, let's go back. All right, so those are some of the home exercises that you can do. And again, it helps so much just stretching my shoulder joint and muscles. And it's actually helped greatly to lessen the stiffness in my shoulder. So even a couple days ago, I wasn't able to make a movement like this. Even just doing this was a big deal for me. I can even raise my arm up like this. Now above this point, it starts to really hurt. I still have a lot of stiffness, but even doing this was a huge breakthrough for me. I can shampoo my hair now with both hands. I can reach up and get some bowls and cups out of my kitchen cupboards. It's incredible. Some of these little changes make such a big difference in our day-to-day lives. So for me, that's been a huge help. I'm also still regularly using ice packs to keep the shoulder cool, to help reduce inflammation and swelling there. Been doing this several times a day still, especially after doing some of the stretches and workout routines. I like to ice the shoulder down. Also at night, laying in bed, I'll ice it down before falling asleep as well. I know I highlighted this in another one of my previous videos, but this thing, this Breg Polar Care Kodiak ice machine. All you guys watching this is such a great thing to have. Again, you put ice bags and ice water in this tank, plug it into an outlet, and nice cold, icy cold water will run through these things and keep your shoulder nice and cool. So I've been using this a lot, watching some Netflix and relaxing. This thing is amazing. Highly recommend it. To go back to the doctor appointment, the post-op appointment I had a couple days ago, they were able to take my stitches out. So I'm here at the post-op doctor's appointment a week later, and there's the stitches here in the front. I don't know if I can get a good view of the back. You can kind of see that there. But getting the wound redressed today, and then we'll be back next week to get the stitches out. So making progress. So let me backtrack a little bit. Exactly 1 week after my surgery, I had my post-operative doctor appointment. And at that doctor appointment, I was able to get the stitches out of my shoulder. There was, I think, 2 in the front and 2 in the back, which was huge. So within 1 week of having the surgery, I was able to remove my stitches. Why that was such a big deal for me is then I could shower and bathe like a normal person again. So as soon as the stitches were removed, I got the okay to take showers, which felt great. I didn't have to put saran wrap on my shoulder. I didn't have to kind of dangle one, part of my body in the shower and the rest of it out. So it just made a huge difference. What a relief to actually be able to shower normally again. So they did an x-ray also at my post-operative doctor appointment, and the x-ray looked great. Things seemed to be looking good as far as where everything was aligned. So those were 2 great things. So got some positive news from an x-ray, and also was able to get the stitches removed from my wound. Some of the things that I've experienced in this last week, again, it's been 2 weeks since I've had my surgery. The pain has gone down immensely. So it's just a soreness, when I move it certain ways. It's usually a little more sore in the morning when I wake up. I'm no longer wearing the sling anymore unless I'm going out into public. If I'm shopping, it's more of kind of giving people around me a heads up to not, get too close to me, knock into me, come up and pat me on the back, which, with the pandemic going on, it's kind of, people are keeping their social distance anyway. So, it's not really been a problem with the sling, but I still like to have it on when I go out in public. Other than that, I do not wear the sling anymore at all in my apartment. I haven't worn it at all when I go to sleep at night. I don't need it. I'm still sleeping on my back. I will roll over sometimes on my right side to rest. So obviously I'm not sleeping on this shoulder at all at night, but I haven't needed the sling. I'm confident enough. I'm not rolling around too much that I know of and that I'm aware of in my sleep to need the sling. So 2 big things there. So I no longer need the sling every day. The soreness and the stiffness has been reduced immensely. I'm only taking maybe 1 or 2 ibuprofen pills a day, usually once in the morning, once at night. And these physical therapy exercises have reduced a lot of the swelling, inflammation, and stiffness immensely. So keeping up with this, I'm supposed to be doing these physical therapy exercises for another 4 to 6 weeks after the surgery. So I will be continuing to do that. I have another post-doctor appointment coming up about a month after the surgery, so about 4 more weeks. So hopefully I'll have some good news at that. Right now, I am not allowed to lift more than 5 pounds of weight with my left arm. So right now, still going through the resting process, trying to keep it light and easy for this guy as much as possible. But it's feeling great. So me personally, I think I've been making great progress with this. I know different people can react differently to the surgery and the post-op process, but so far with me, it's been smooth sailing for the most part. Again, just to backtrack, a lot of the pain in my shoulder was about 1 to 5 days after the surgery. Really just day 1 to day 3 was the most painful for me. After that, it's kind of been gradually reduced since then. So far, I think I've been making great progress. If anybody has questions concerning anything pre-op or post-op, let me know. Again, I'm not a medical professional, I'm not a doctor, but I can tell you from my own experience, what I've been through, things that may help. So if you have questions, concerns, anything along those lines regarding distal clavicle osteolysis, feel free to leave a comment below, and I will keep you guys posted as the days go on as far as my progress goes. Again, my next doctor appointment is at the end of April, so I might do a video when I get out of there. So I will keep you guys posted. Again, I'm looking forward to hopefully getting back to my full strength and full workouts this summer. I know it's going to be probably a couple more months until I can really get the green light to do any sort of heavy lifting with this arm. Obviously, I'm going to be listening to what my doctor and physical therapist says, but I'm very, very anxious to get back into it, get back to a normal routine. And I guess, this whole surgery for me has been at such a weird time because of the pandemic going on. I was already self-isolated at home recovering with the surgery the week all this stuff started to break out, at least here in Illinois, in the Chicagoland region. So for me, I'm not saying it's a convenient time to have surgery. I don't think any time really is necessarily convenient to have surgery. It's something we hope to avoid. But the timing of my surgery was kind of weird as it coincided with this whole isolated stay-at-home coronavirus pandemic. So I guess the whole country and world is kind of taking it easy right now, which makes it a little easier for me to sit back and take it easy. But that being said, I hope everybody is staying safe through this. And again, if you have any questions regarding distal clavicle osteolysis, or would like me to do another follow-up video with some more details on the recovery process, let me know below. I think with that, it is safe for me to say it is time for me to get out of here. Well, actually, I'm going to stay here. It's my apartment, but that's kind of my new motto. So what else can I do? So anyway, I'm going to turn off the camera. I'm going to get out of my living room, and I'm going to go cook some food. Just in case you guys are curious, this is what my scar looks like now that the stitches are out. Let me see if I can focus that. Maybe not. But it's just a small little incision. That'll probably be there for a couple years. It's supposed to fade away over time, but it's not that big. So it doesn't really bother me. I still have feeling there. I saw that some people online say that it's numb, they don't have feeling, but I still do where that scar is. So not too bad. There's another small one in the back, about the same size, but it'll go away over time. All right. Well, hopefully that helped. Let's get back to the original show.